Okay. It is my pleasure to introduce Maritza Valencia. She graduated from California State University, Sacramento, obtaining a degree in health science with a concentration in community health education. She has worked for Sacramento Covered for about 6 years with different roles and projects. Today, she oversees a few different projects, including increasing dental prevention and care services among children ages 0 to 20, CalFresh, and Unitas, which is a coordinated care network with a broad range of resources across the social determinants of health. Maritza enjoys spending time with her family and cuddling with her dogs. Please help me welcome Maritza by giving her a round of applause.
Thank you so much, Tia. And I'll go ahead and share my screen. I'm definitely excited to be here today, and more than anything, share a little bit about the work that we do at Sacramento Covered and how that really speaks across different communities and how different sectors come together and really for the main goal, which is addressing the barriers to care. So let me go ahead and get started. Give me just one quick second. Thought I had this ready. Perfect. Please let me know if you are all able to see my screen. You're good? Okay. There we go. So as I had mentioned, I'm here today sharing a little bit about the work that Sacramento Covered does in the community and really how this speaks to all the different sectors that we work together with. So I'm hoping that with this presentation today, what you will be getting is a community perspective of how different organizations, including ourselves, are working in the community really hard to really make sure that aside from the medical direct services that our community is receiving, we're also addressing the barriers that are preventing them to access healthcare. So today I'll be speaking a little bit more, just briefly, about Sacramento Covered. I'm sure either one, we are very much confused with Covered California, and I want to make a quick distinction. We are not Covered California. However, you know, we do participate in some of the funding within. So I'll talk a little bit more about that. I want to make sure to dive into the programs within Sacramento Covered and how that really speaks to the diverse work that we do, and really speak to the services and ultimately how we are connected in the community. How does the community connect to us? So who are we? We are actually a nonprofit. We're a community-based organization. We've existed as a nonprofit since 2013. However, I say we, Sacramento Covered previously was a city program back in 1998. It was previously called Cover the Kids. And through this program, the agency was primarily focusing on children, enrolling children into what we used to know as the Healthy Families program. So through the Affordable Care Act, it was actually at the very same time, we realized that our families are not only needing help with their children, but they themselves, the parents, the caregivers, the extended family, were also needing assistance. And so we took a step further and we went ahead and became a nonprofit back in 2013. So we really have evolved from an agency that is primarily focused on just enrollment to a nonprofit that is really focused on the wraparound services of the individuals in the community and really addressing their personal challenges to access health care. So I just wanted to make sure to share with everyone that as I mentioned earlier, Sacramento Covered is sometimes confused with Covered California, and I think it goes beyond the work that we do. It's mainly the name. So I just wanted to make that quick distinction, as that happens very often and no one is to blame. I can't go back to that. A really quick to the programs that we have here in Sacramento Covered. It's mainly broken down into to 3 different programs. Later on, I'll be mainly focusing on the health navigation program. This is a very community-based. Our work really supports the people, I say the community, getting health coverage, primary care services, access to nutritious food, resources, and really other community resources that each individual that we come across with may need. We serve the uninsured population and one of the most vulnerable communities that are at risk of homelessness, and I'll speak more to that under the health and housing program. But we serve the uninsured, the vulnerable communities, regardless of age, immigration status, socioeconomic backgrounds. Our health navigators, I want to say, are cultural competent and provide assistance to all the clients in their preferred language. A lot of it has to do with our health navigators already having first being bilingual or even multilingual. And some of the languages that we have in-house at Sacramento Covered include Spanish, Russian, Ukrainian, Hmong, and also Romanian. So these are some of the languages that we use in-house, but of course, we do come across other clients that have other language preferences. And so in order to provide that in-language service, we do use a language interpreting line. And again, the main focus of this specific program is to be able to connect and really address the barriers that each individual is facing. Within the health navigation, I mentioned earlier enrollment to health coverage, right? We also do cover California. It goes back to the confusion in the name, but really a lot of the population that we serve includes Medi-Cal. And we do help our community also apply for CalFresh. And I'll speak a lot more in detail in these different bullet points, but health navigation also provides pediatric health navigation, pediatric being in the hospital setting. We have dental navigation that we focus on. I feel a lot of the times we tend to focus even the community on primary care, but our focus is also dental navigation, making sure that families who have or don't have, help them enroll into health insurance, and then really get them connected to primary and dental. We know that dental and oral care is a really big part of someone's overall well-being. And I previously mentioned earlier, working with the community, we use referrals. We work with our community to address the social determinants of health. And we do so working with 2 different platforms, the Unitas and the My Navigator resource list, which I'll touch on a little bit later. With the patient navigation program, we have patient navigators that are stationed at the heart of the hospitals, at the emergency departments. And what these patient navigators do, and their primary focus, is to support the patients that are coming in that would typically be for primary care purposes. Maybe they came in for a cough, or they weren't feeling well. Well, otherwise, this would have been something that their primary care provider would have addressed. And so the patient navigators see these patients in the emergency department, and what their primary focus is, providing education, using this as a teachable moment once they are with the patient, and talk to them about their benefits and try to understand what it is preventing them from actually seeking care with their primary care provider. Is it that they just don't like their primary care and they just don't know how to change their provider? Is it that they don't even know that they have a provider to actually see? Do they not know about the urgent care centers that is available to them? So these are all some of the services that the patient navigation does. At the same time, providing follow-up care. Some of the patients that they see at the emergency department may come in due to a broken leg, and so needing that referral to specialty may sometimes be delayed. And so some of the work that the patient navigators do within this program is to really address and expedite that piece in order to have the patients get seen a little bit quicker, instead of not knowing who to call, where to go, and whatnot. Some of the hospitals that our patient navigators are located in is at the Methodist, Mercy General, Mercy San Juan, Mercy Folsom, all the Dignity hospitals. We also have a patient navigator at the UC Davis Medical Center Emergency Room or Emergency Department. And at the Sutter Hospital is where we have the pediatric health navigators, where they're really helping the newborn department, the pediatric department. The patient navigator program is a closed referral, and the reason behind it is we are attempting to reduce the emergency room visits versus having an open referral and having partner agencies refer into that program. So it's closed in the sense that we don't have partners referring into this program, but it's opened in that anybody in the patient, any patient in the emergency room department would be able to receive their assistance. And I would say primarily our focus is within the Medi-Cal population and those that are uninsured, but of course, if and when there is a need, our patient navigators are there to help. I want to go ahead and touch on the health and housing program. This program is a little bit different from the work of the other two navigation programs. This program is field-based. Within this program, we have community health workers, and they support the individuals with complex health and behavioral health issues, and or they are experiencing or they're at risk of homelessness. And so their main goal is to connect to health and housing services. More in particular, I'll speak to, there's two different programs. There's the Health Homes program, which is actually an additional benefit through the Medi-Cal program for those individuals that are experiencing more chronic illnesses. And as I mentioned, that may include as well those individuals that are experiencing or at risk of homelessness. And so this is actually not a closed referral program. Anybody who has Medi-Cal, anybody who has Medi-Cal and has a health plan attached to their Medi-Cal can benefit if and when they meet those specific requirements. And again, going back to the chronic illness. So this isn't closed necessarily to any of our partners, anybody who would like to benefit from this additional program, but it is, there are eligibility requirements. Then there is the community health workers that are within the Pathways program, which actually this program works very closely with the hospital partners to case manage individuals that are experiencing homelessness or at risk and address the barriers to resources, including health and food, I'm sorry. So in this case, this is a closed referral, and only designated partners are able to refer into this program. So in this case, for the most part, the hospital systems have their own point of contacts that are working very closely with these community health workers. Again, the main goal here is to address their health needs and work together in a coordinated effort. Some of the additional resources or benefits of being within these two programs are that the community health workers will provide assistance with Social Security income enrollment, with the actual application. They do provide a level of support for housing as well, whether that's connecting to a housing agency. They work very closely with the housing agencies and work together again to really care coordinate the needs of these individuals. As I had mentioned, we meet people where they live, where they work, and we also say where they play. We go into the neighborhoods, the clinics, the hospitals. With the health navigation, we're in the schools. We are in the WIC offices, and although right now with the COVID pandemic, we were hit hard because most of the work that we provided was mainly in person. However, we've been working really hard to adapt in order to be able to continue providing these services to the community. And as I had mentioned earlier, the services that we provide, we do so in language. We mitigate the barriers to care, and I'll speak a little bit more in the next slide. And these barriers may include transportation, food insecurity, access to care is a big focus of ours, but it's also access to other resources, because obviously we understand that Sacramento Covered does not provide all the services that an individual may need. So we do work really close with all of our other partners to be able to address that as well. Some of the more specific services that the health navigation team provides is, as I mentioned, a wraparound. We help someone who comes to us from point A to point all around the circle, from A to Z. We help them enroll into health coverage. Maybe they came to us when they've already had submitted their Medi-Cal application and they don't know where the status is at. Maybe they went into their primary care appointment and the front desk staff shared that they are no longer active. So these are all the different case scenarios in which we come across with our clients in the community, and how we help them really address that, being active with their benefits, having coverage for any time whatsoever needing to access their care, whether it's emergency department in an emergency or it's really their overall primary care services. As I had previously mentioned, some of the times, and we get this a lot, some of the community may not know who their assigned provider within Medi-Cal, or that they can choose a provider with their Covered California coverage. So, and for the most part, I'm going to be concentrating on Medi-Cal, but a lot of the times, all these messaging on the rights of the patient is not really provided other than in forms. And as we all know, we may read forms in the application, but we read it once and we put it to the side, right? And so a lot of the times we provide education and we help them find a provider that meets the needs that they are actually looking for. They may be assigned to a provider that's all the way across the county, and that doesn't work for them, right? And so this is the same thing for their children. They may have a different pediatric provider for each of their child, and so they really want to have one pediatric where they can take all their children to. We help them schedule their appointments. If they didn't know about their health or their primary care provider, their dentist, they most likely are needing assistance in scheduling their first-time appointment. And this goes back to the fact that the Medi-Cal program is impacted. Medi-Cal providers are impacted. So first-time appointments may not be within a few weeks when they have a cough. It may actually be in 2 to 3 months. And so that does not, make sense for the client that is currently experiencing some health concern and needs to be seen sooner than later. So we do help them with scheduling appointments. And going back to the reason why I'm here is addressing the barriers to care. We understand that some of our community do not have a car. They do not have potentially the form of being able to use Lyft, regardless of what that reason is. And so a lot of the work that we do is helping them coordinate a ride to their appointments. We don't want transportation to be the reason why they're not attending their appointments, why they're not seeking care. And so a lot of the times it goes back again to educating Many individuals do not know that transportation is a benefit to them with their health coverage with Medi-Cal. And so we provide that ongoing support, the hand-holding, if you want to say so, calling their health plan and going through step by step on how to actually coordinate this ride. The health plans require certain information, so making sure that they are prepared before that call in order to have that information ready. So a lot of that is some of the work that we do. In addition, through Sacramento Covered, we are lucky to have funding available for last minute transportation needs. For example, if a client calls us and says, my friend was taking me to my appointment, however, they're not going to be able to now, and I don't have a ride to my appointment. And so we are able to provide a Lyft rides to our clients in order to be able to go to their appointment the next day. Or for whatever reason, they're not able to get to their appointment the next day, we do provide Lyft rides. Coordinate a language for an interpreter for appointments. The same thing, we've talked about how Sacramento County is very diverse and that there's different, not just cultures, but also languages. You know, it ranges from Vietnamese, from Russian, and, you know, a lot of the times I would prefer to have my provider and be able to understand what my provider is telling me, and not having my 11-year-old child interpret for me, or take alongside with me a family relative that I'm not very comfortable with them knowing my health conditions, and yet that's my only option. And so what we do is again, interpreting is part of a benefit for all the Medi-Cal population. And a lot of times either they don't know or they're intimidated to calling the health plan. Again, automatic machines or options is the first thing that we come across with when we contact the health plan. And so them not knowing what options to choose and feeling intimidated and just giving up at that point. And so just the same way that we do with transportation, we do with interpreting. And as I mentioned earlier, there's a wide range of different factors to someone's well-being and health, right? We go back to the social determinants of health. But really what we try to address is that it's not just about health. Someone who, you know, is facing food insecurity, health is the last thing they're thinking about. The last thing they're wanting to do is go to see a primary care provider, right? Taking their child to the dentist, because what they're really worried about is having food on the table. And so what we do, again, going back to CalFresh, we do provide support to our clients to apply for CalFresh in the same way that we do for Medi-Cal, regardless of that being the initial start of the application or helping them schedule that interview that they missed. So we really try to provide support in that aspect as well. And when they share with us that they really are limited in financial, in the financial aspect, maybe they really are, you know, have nothing in the bank, they're running with $50, and so they need expedited food benefits. And that is a benefit through CalFresh as well. You know, so we try to provide as much information to our clients as we can in order to get them the specific and unique needs that they have. Connecting to other resources. So we talked about what Sacramento Covered does, and we don't do everything. We don't do housing within the health navigation. And so that's a huge need nowadays, right? And so one of the things that we do is we work really closely with other partners. Same thing with the food bank and family services. We don't provide actual produce, but we know that they do. And so does other partners in the community, River City Food Bank. And so what we do is we work really closely with them in order to what we call warm hand off our clients to these partners. I wanted to share, I have some stories on here to share just to showcase the work that we do. So I'll go super fast on this. I didn't realize I have 5 minutes on here. So really quick story. Maria's partner was recently deported. This is actually a real client that we helped out. So Maria's partner was recently deported. She was left alone to take care of their 10-year-old child. Due to the pandemic, she also lost her job and was ineligible to receive unemployment benefits, which was the sole method of income for herself and child. She made ends meet by using her savings. However, she was exhausting her savings fairly quick. She feared applying for benefits, and this is due to counting against her and deem her as of a public charge. Maria shared that she had a recent visit to the emergency department and was concerned about the hospital bill and medication. She was granted with hospital presumptive eligibility, but didn't understand what that really meant. And so some of the services that our health navigator within the health navigation team that they provided was information about Medi-Cal benefits and covered services. They provided information on CalWorks and CalFresh. They supported the application and submission to CalWorks. They supported navigating the hospital bill, making sure that it wasn't coming to the client, but actually was taken care of through Medi-Cal. Again, they supported with the Medi-Cal case after the hospital presumptive eligibility ended. And for those that don't know this, hospital presumptive eligibility is not necessarily Medi-Cal. It's temporarily, for the most part, about a month. That does provide a full scope Medi-Cal, but other than that, it's not actually Medi-Cal. And then schedule medical appointments, both for to see the dentist and specialty care. And one of the things that I really want to emphasize is one of our health navigators also provided her assistance to get connected to the COVID relief programs. And the program was actually the disaster relief assistance for immigrants. And then for the children, there was a pandemic EBT benefit that came across. There was other, another story I wanted to share, but really quick, I want to end by just saying that as I keep talking about Sacramento Covered working with other community partners, we have an electronic referral. We call it Sacramento. It's within the Sacramento Community Network, and this network lives within the Unitas platform. This is where we can easily refer and connect individuals to local resources. We're able to track referral outcomes, build and strengthen partner collaborations, and more. So more specifically, it is a HIPAA compliant platform, which really allows the partners to have communication amongst each other. So that's a really huge benefit. If someone refers out to us, we're able to update the outcome for them so that that agency understands what happened with that referral, which is a huge piece within the community organizations. Sometimes those referrals get lost, and this platform provides that communication within each partner. I do want to say, if anybody is interested in learning more about this Unitas platform and this effort, please reach out to me. We're working with even the student-run clinics with UC Davis, specifically the Willow Clinic. So there's more to come on that piece. The other way that we'll share information with clients is through our call center, which is on there. And I'm so sorry I ran out of time. I just realized towards the end.
No problem. Thank you so much, Maritza. Can everyone please give her a round of applause for your comprehensive overview of the services offered?